Welcome to LabGuru, the MCQ bank for the medical laboratory technician and technologist. Here we are starting with the topic phlebotomy. As you know, the phlebotomy is very important. Without phlebotomy, we cannot perform any blood test, right? So, our first question of the set is, the term phlebo refers to what? Here the options are option A, artery, option B, vein, option C, nerve, and the option D is muscle. The question is asking the word phlebotomy. You can see here the word phlebotomy is composed of two Greek words. The prefix one is phlebo and the suffix one is tomy. So the prefix phlebo means vein. Here the right answer is option B, that is vein. Question number 2. The suffix tomy means what? Same word phlebotomy. The suffix, the last part of the word tomy means what? Options are study of, removal, option C is cutting, incision or puncture, and the option D is disease. So here the suffix tomy means cutting or incision or puncture. So altogether if you see, the whole word of phlebotomy means vein puncture or vein incision, right? Question number 3 is, the most common site for blood collection or vein puncture is, which is the most common site for vein puncture? Here the options are, option A is radial artery, option B is median cubital vein, option C is femoral artery, and the option D is jugular vein. You can see in the question it's written here for vein puncture, so we have to pierce in the vein. In the option you can see radial artery and femoral artery, so you can exclude these two. Option A and option C you can exclude. Now you have two options, B and D, right? Because we are searching for the vein puncture. So the option B, the median cubital vein, is the most common site for blood collection. You can see in the picture, the median cubital vein is present in the cubital fossa of the hand, and it's just opposite to the elbow. It is very intact and it is not easily that much sleepy, and it is very easy to collect the blood from here. That's why it is preferred first. Okay. Next question is, tourniquet should not be applied more than how much time? It's asking. Option A is 30 seconds, option B 1 minute, option C 5 minutes, option D is 10 minutes. Tourniquet is a compression bandage. It might be rubber strip, plastic or cloth strip also. So it should not be applied more than 1 minute. The right answer is option B. That's 1 minute. Okay. Because prolonged use causes the hemoconcentration. So always take care that the tourniquet should be less than 1 minute. Next question. Angle of needle during vein puncture. When we are doing the vein puncture, the angle should be option A 10 degree, option B 15 to 30 degree, option C 60 degree, and option D is 90 degree. Here the right answer is option B 15 to 30 degree. The angle between the needle and the surface should be the 15 to 30 degree, which ensures the smooth entry and good blood flow. Most common complication during blood collection. When doing the blood collection, what is the most common complication? Option A is fever, option B is hematoma, option C is cancer, and option D is hypertension. So which one is the most common? The right answer is hematoma. Hematoma means swelling and clotting inside the tissue. It is caused by the improper technique. Sometimes we are inserting the needle in the bad technique, so multiple prick can be done, causing the hematoma, internal bleeding. Okay. Next question is, During blood collection, skin is cleaned using, when we are doing the blood collection, before doing the blood collection, we are cleaning our skin with what? Option A is water, option B is spirit or alcohol, option C is saline, and option D is glucose. So we are using the spirit or alcohol because these are the disinfectant. Spirit and alcohol prevents the contamination and infection. That's why we are cleaning with the spirit or alcohol. Next question, capillary blood is collected from. Capillary blood is collected from where? Okay. Option A is vein, option B is artery, option C is skin puncture, and option D is bone marrow. So we are collecting the capillary blood from skin puncture. Okay, we are collecting from skin puncture and mainly from the finger prick, mainly obtained by the finger prick. Next question, the site for capillary puncture in adults. Here the best site for capillary puncture in adults is option A thumb, option B index finger, option C middle finger or ring finger, and option D is little finger. So the right answer is option C, that is middle finger or ring finger. Why? Because middle finger or ring finger have the good flow of blood and less pain. So we are preferring that one. Next question, heel prick is done in. Heel prick is done in which case we are doing the heel prick? Option A adults, option B children's, option C infants, and option D is old age people. So here the right answer is option C. Heel prick we are doing in the infants only, because it is a common site for newborn blood collection. Okay. Hemolysis occurs due to, what is the reason behind hemolysis? First one is proper technique, option B gentle mixing, option C rough handling, and option D is correct needle. So what is the reason behind hemolysis of a sample? The right answer is rough handling. Rough handling can cause RBC destruction and result in the hemolysis. Okay. Question number 12. First step before blood collection. What is the first step before blood collection? Here the options are option A skin disinfection, option B patient identification, option C throw needle, and option D label letter. It's a very common and simple question, but sometime in the hurry the student do the skin disinfection as the right answer. But here the right answer is the patient identification, because patient identification only can prevent the wrong sample errors, right? Question number 13. Arterial blood is mainly used for. The blood which is taken from the arteries is mainly used for what test? Okay, which test is done by arterial blood? The options are option A CBC, option B blood sugar, option C ABG analysis, and option D is ESR. So the arterial blood is used for arterial blood gas analysis, and the most preferred arterial site for the arterial blood collection is the radial artery. And the ABG analysis includes the measurement of oxygen, carbon dioxide level, bicarbonate, and pH also. Our next question is prolonged tourniquet causes. If we are applying the tourniquet for a long time, what will be the problem? Okay, so the options are option A is hemodilution, option B hemoconcentration, option C infection, and option D is bleeding. So if we apply tourniquet for a long time, the hemoconcentration will happen, which increases the protein and cell concentration and alters our test reports. Question number 15 is needle gauge commonly used for the vein puncture. What is the size of needle which we are using for vein puncture commonly? The options are option A 10 gauge, option B 16 to 18, option C 21 to 23, and the option D is 30 gauge. So the right answer is 21 to 23 gauge needle size is commonly used for the vein puncture. Why? Because it is the standard for vein puncture, and actually it causes uh, good blood flow with the less pain. Next question is collapsed vein occurs due to. The options are due to large needle, due to excess vacuum, due to gentle draw, or due to small tube. What is the reason? Here the right answer is excess vacuum. During the blood collection procedure, if we pull the plunger of the syringe very hardly, that time due to the excess vacuum, the veins get collapsed, which pulls the vein wall inwards. So always prefer gentle draw of the blood sample. Question number 17. Vacuum system advantage. What is the advantage of vacuum system? It is an open system. Option B, it's more contamination. Option C, it is a closed and sterile system. Option D is it is slow. What is the use of the vacuum cleaner? So the right answer is it is a closed and sterile system. The option C is the right answer because it is a closed and sterile system. It reduces the infection risk. Right? Next question is vesic vein should be used carefully because when we are pricking or when we are inserting the needle in the vesic vein, why we have to be more careful? The options are vesic vein is too small. Option B, it is near to the artery and nerve. Option C, no blood flow. Option D is painful only. So the right answer is option B because the vesic vein is very near to the arteries and nerves, so you have to be more careful. Higher risk of injury if you insert the needle instead of vein to the artery or nerve, it will get risky or it will get the injury to the patient, so you have to be careful. Question number 19. Syncope during the blood collection means. Option A is fever, option B is fainting, option C is vomiting, and option D is bleeding. What is the meaning of syncope? So here the right answer is fainting. During blood collection, syncope means fainting. It is a very common in anxious patients who is fear of these needles and bloods. These patients can get syncope during the blood collection. Question number 20. Blood should not be drawn from arm with tattoo. Option B is IV infusion. Option C is hair. Option D is watch. Which arm we will not prefer to take the blood sample? So the right answer is option B, IV infusion. If someone is getting IV infusion in the hand, the same hand is not used for the blood collection. Why? Because it can cause the dilution of the sample. Next is first drop in capillary puncture should be, when we are doing the capillary puncture, the first drop should be, first one option is option A used, the first drop should be used. Option B is wiped away, we have to wipe away. Option C, we will store it, and option D, we will heat it. So during the capillary puncture, the first drop should be wiped away. Okay, why? Because it contains the tissue fluids. Tissue fluid can dilute your blood sample and result will be inaccurate. So the first drop in the capillary puncture should be wiped away. Next, heel puncture site in the infants. In the infants, we know we are doing the heel puncture. What's the best site? Option A is center of heel. Option B, posterior curve. Option C, medial or lateral plantar surface. And the option D is anywhere. So the right answer is medial or lateral plantar surface. Okay, medial or lateral plantar surface of the heel is preferred because it is a safe area for puncture. Next, maximum depth of heel puncture in infants. What is the maximum depth of needle during the heel puncture in the infants is option A 5 mm, option B 2 mm, option C 10 mm and option D is 8 mm. So what is the proper depth? Our maximum depth is 2 mm. You should not puncture more deeper than 2 mm because it prevents bone damage. Otherwise there is a chance for bone damage. 24 number question you can see here. Needle disposal should be in plastic bags. Option B is the paper. Option C is the sharp container. Option D is pocket. Which of these we will use to dispose a needle? So the right answer is the sharp container. The sharp container means a puncture proof container in which if we put the needles and sharp things it will be not punctured, not teared. So the right answer is the sharp containers which are puncture proof. It prevents the needle stick injury. Okay, why we are using this container? Because it prevents the needle stick injury. Next, needle stick injury risk is highest during when the needle stick injury is at the highest risk. Option A you can see here. Option A is the talking, when you are drawing the blood and talking with someone. Option B is recapping the needle after completing the blood collection when you are recapping the needles. Option C is the walking. Option D is the labeling. At what time it has the high risk for needle stick injury? So the right answer is recapping. Most of the time when we finish our blood collection, while recapping the needle, we got injured with the needle stick injury. So it is the most probable period when needle stick injury occurs. So it should be avoided. How we can prevent? It should be avoided. Question number 26 is here. Arterial puncture is most commonly done at what is the site where we are doing the arterial puncture mostly? So the options are option A femoral artery, option B is the radial artery, option C is the carotid and the option D is the brachial only. So the right answer is option B, that is the radial artery, most preferred site for the arterial blood collection because it is very easy to accessible and safe also. Next, Allen test is done before. What is the Allen test and when it is done before? Let's see. Options are vein puncture, option B is capillary puncture, option C is arterial puncture and option D is ESR when we are doing the Allen test. The right answer is option C arterial puncture. Before doing the arterial puncture, Allen test is done which checks the collateral circulation. Okay, collateral circulation is checked by this Allen test. Question number 28. Which vein is last choice of vein puncture? In these options, which vein we will prefer for last one? Option A is median cubital, option B is cephalic, option C basilic and option D is all are same. So here the right answer is basilic. Why? Because the basilic is very close to the nerves and artery. You can see in this picture, you can find here, this one is the median cubital vein. We preferred must. It is the first choice. Okay. Then side of this there is a cephalic vein. After median cubital, we prefer for the cephalic. But the basilic is the last option. Why? Because you can see here behind the basilic vein there is a artery also. Okay, and there is a, this yellow color is the nerve. So basilic vein is surrounded by the arteries and nerves network. So it is sometimes can get the injury. Okay, so the first choice is our median cubital vein, median cubital. The second choice is cephalic, and the last choice is only the basilic. Clear? Question number 29. Small needle size may cause. Option A is the fast flow, option B is hemolysis, option C is no pain, and option D is serum. If you are using a small needle for blood collection, what will be the result? So here the right answer is option B, hemolysis. The chance of hemolysis is increased. Why? Because due to the small needle size, the pressure is high. The blood pressure is high. So high pressure can damage the RBCs and result in the hemolysis. The last question is here. A patient with history of mastectomy should have blood drawn from. Mastectomy means the surgical removal of breast, mainly done in the breast cancer. So if it is in the right side, which side we will prefer for the blood collection? So options are the same side, option B opposite arm, option C is foot, and the option D is any vein you can choose. So if the mastectomy was done in the right side, you will prefer left arm, because the right answer is the opposite arm. Okay, why? Because of the risk of lymphedema and infection on affected side. If the affected side you are taking the sample from the same side, the risk is increased for the lymphedema and infections. So we will prefer the opposite side, opposite side arm. Thank you for watching the video, and subscribe and like more if you want to stay tuned with our channel. Thank you.